So hello guys, welcome to my another videos of my YouTube channel. Okay, so today I'm going to share one video like the oral anti-oral diabetic agent. Okay, so first of all we have to know what is the diabetic case. So let me know you means the diabetic case, we can see the increasement of the glucose level. Okay, mean the glucose level will be increased in our blood from the normal. Okay, so for reducing the normal glucose level means to control or to maintain the normal glucose level, we should do or we should manage the condition, right? So for managing that condition, we are using one kind of drug called sulfonylureas. So today I'm going to share this kind of information after using the sulfonylureas, how we will able to reduce the diabetes condition. Okay, so see, incident is happening in all level, all incident is happening in the pancreas, right? So see, so that one is the drug sulfonylureas. Okay, so after giving this type of sulfonylureas, it is sulfonylureas, after giving the sulfonylureas drugs, that sulfonylureas drugs is binding with the receptor called sulfonylureas receptor. Okay, did you get it? So this is the drugs. After giving this type of drugs, we can see this drugs is coming through our GIT tract and it is binding with the receptor called sulfonylureas receptor. Okay, after that we can see one kind of channel is there called ATP. What is that? ATP dependent potassium channel. Okay, so that ATP dependent potassium channel, what is doing? It is inhibiting, means inhibiting, it is inhibiting the binded one, mean after the bonding. So the potassium ATP dependent potassium channel is inhibiting the attachment of the sulfonylureas with the beta cell. Do you get me? I think no. So mean how it is being happen, mean after giving this type of sulfonylureas drugs, this drugs is binding with the sulfonylureas receptor. So for the bonding or the due to the bonding with the sulfonylureas receptor, we cannot see the directly attachment of the beta cell to the beta cell because of the presence of the ATP dependent potassium channel. So due to the presence of the ATP dependent potassium channel, we can see the inhibitions of the attachment to the sulfonylureas with beta cell. Okay, so due to unable to attach with unable to attach with beta cell, we can see the calcium 2 plus ion is triggering beta cell, and as we all know that beta cell is present in the pancreas, right? So after triggering the beta cell, we can see the releasement of the insulin granules. Okay, what is that? After releasing, after the triggering the calcium 2 plus ion, we can see the releasement of the insulin granules. Okay, so that insulin granules, as you all know, the main functions of the insulin is to reduction of the glucose level, right? So here we are getting, means here we are able to, from this way we are able to reduce the glucose level, right? Because we can see the productions of the insulin granules, right? Due to the triggering of the calcium 2 plus and to the beta cell, we can see the releasement of the insulin granules, right? So after the releasement of the insulin granules, we can see the insulin granule is help to decreasing the glucose level. Okay, decreasing glucose level because the insulin granules is already produced, right? So after productions of the insulin granules, we can see the releasement of the glucose, means the glucose level will be decreased. Okay, so that glucose level, when the glucose level is converted into the glycogen, okay, so that much amount is converted into that much. means what? Means the hyperglycemia to hypoglycemia. Okay, hyperglycemia to hypoglycemia, it is converting, means the glucose level is the decreasing, right? So if the glucose level is decreasing, mean what? Thereby we can see the storage of the glycogen, means the storage of the glucose as a glycogen into the liver. So thereby we can see the reductions of the glucose into our blood. Okay, so for your kind information, let me know you, when the individual or any kinds of person in the fasting period, means he's not taking any kinds of food or any kinds of uh, he's not taking any kinds of food. Okay, so that time we can see that glycogen is slowly metabolizing, right? Slowly metabolizing means the glycogen is slowly breaking down into small particles, and glycogen that glycogen is helping helping the individual to survive for further days. Not for long days, but it will help that glycogen. After the metabolization of the glycogen, we can see the individual will able to live little bit more days without diet or without consuming any kinds of food. Okay, so that is the fact. uh, I think you all understand. For okay, so again I am repeating. So all incident is happening in the pancreas, and after the conversions of the beta cell to the after the releasing of the beta cell from the beta cell to the insulin granules, we can see the decreasing of the glucose level. Okay, so thereby you can see the conversions of the glucose to the glycogen. Okay, so that glycogen is stored into the liver, and whenever it necessary, the glycogen is metabolizing and producing our energy. Okay, so like that only, or in that way we are able to produce, or we are able to reduce the diabetic case, right? So what is the fact? In the beginning I told that diabetic mean the glucose level is increasing. So after giving this type of drug, sulfonylureas, right, by the inhibition of the ATP dependent potassium channel, the releasement of the insulin granules and the conversions of the glycogen, we are able to reducing we are able to reduce the glucose level into our blood. So thereby we can reduce the diabetic condition. Okay, or in case of the management, or otherwise in the general in management only, where directly introduce insulin. So directly introducing insulin as a directly introducing of the insulin, in that way also we are able to reduce or control the diabetic case, or otherwise diet controlling, right? So in that way also we are able to control the diabetic conditions. So I think you will understood. Okay, so if you like the video, do likes, and please subscribe the channel. Okay, and please share the video. Okay, and for getting more uploaded videos, please subscribe the channel. Thank you. Stay safe, stay happy. Goodbye.